Hey, this is Rick Cartilage from exercisesforinjuries.com. I was down here in Irvine, California at a conference, and I got chatting with Dr. Peter Osbourne, and he was talking about some interesting stuff when it came to diet and knee cartilage, and I wanted him to share it with you. So I'll hand it over to Dr. Peter Osbourne, and he'll explain to you what he let me know.
Great. So hi Rick, and hi Rick's viewers. Basically, a lot of people, they injure a knee, they injure a joint, and then they go through a rehabilitation program, but they don't consider diet as an important component to the healing process. And so the old adage of you are what you eat plays a really, really big role when it comes to injuries. Really all people have cartilage, and in the joint, that cartilage is made out of a protein called collagen. And so if we don't have the nutrients present for collagen to be able to heal, then what ends up happening is, yes, we can heal, but we heal in a weaker state. So we're more prone to re-injuring that same area once we've gone through a rehab program if we don't address the importance of nutrition. And so one of the major factors that influences whether or not a person is going to heal is an inflammatory process. When we get injured, inflammation is the internal process in the body that tears down that old injured area so that we can bring in new tissues and rebuild that area. So if we do that in a maximum way, in essence, if we achieve a greater degree of short-term acute inflammation to get rid of all the garbage and then bring in good healing nutrients and good properties so that we can get a good foundation for healing, that's ideal. So the diet plays a big role in the propagation of inflammation. For example, in knee injuries, there's a substance found, and I'm going to use gluten sensitivity and people that have a gluten or a wheat problem. There's a substance in wheat called wheat germ agglutinin. And for many people, this compound has a very high affinity for joints or for cartilage tissue. So it goes straight to cartilage or joint tissue, and it basically, for people that have this reaction, it creates an inflammatory response. And it's a chronic inflammatory response, so that this person can never actually really heal. They'll feel better, but the inflammation is constantly low grade. It's like trying to build a home, and every time you get the first floor up, a wrecking ball just comes through and knocks out half of it. So, and then you got to start over a little bit. So, you know, you imagine all these broken timbers and 2x4s, and you're kind of trying to hammer everything together. You don't really get a good structural foundation for a home that way. Well, the same thing applied to the knee. If you're eating foods that are inflammatory, such as gluten or wheat germ agglutinin, then every time you try to get that thing to heal, and you're going to be promoting that inflammation, it's just not going to heal as well for the long term. So you want to consider diet very, very crucially. One of the reasons why so many people with joint pain take glucosamine and chondroitin is because it inhibits wheat germ agglutinin. It actually blocks that compound in wheat from attaching to your joints and creating that inflammation. That's one of the main reasons why it's so great and works so well for pain control. But other nutritional factors to consider, aside from just having a food intolerance or a food sensitivity, you want to consider the quality of fat in the diet, because fat is what breaks down into chemicals that promote inflammation or that promote healthy healing. So if your diet is really super high in grain and very, very low in vegetables, you've promoted a fatty acid ratio that's more prone to inflammation, so it's going to make it a lot harder for you to heal. As a matter of fact, a study that was done a few years ago in the Journal of Neurological Surgery found that taking fish oil supplements instead of taking non-steroidal anti-inflammatories like ibuprofen or naproxen was just as effective at pain reduction, but twice as effective long-term at preventing the injury from recurring. So these people actually had a much greater outcome with their pain by taking something that the body naturally needs versus taking an artificial chemical that just blocks inflammation. So, all that being said, you have to pay attention to diet, you have to pay attention to nutrition when you're doing a rehabilitation program. Otherwise, you're only addressing structural elements and you're not addressing the chemical elements that make the structural elements work the way they're intended to work.
Great. So where can people get more information about you, Peter?
Well, they can find my office is towncenterwellness.com, and so that's where I have a practice in Houston. But if they want to learn more about food allergies and intolerance or gluten sensitivity, they can find us at glutenfreesociety.org.
Awesome. So thank you very much for watching. I mean, that information just absolutely fascinates me. So thank you very much. This is Rick Cartilage from exercisesforinjuries.com signing off, saying take care and bye-bye.